you so much, all of you, for joining us today as we're going to be talking about sharing vaccine facts with SC Thrive in partnership with the South Carolina Department of Health and Environmental Control, DHEC. My name is Annie Crook, and I'm the Midland Regional Coordinator here at SC Thrive. I'm very excited to announce that we do have a guest speaker during this April webinar, Dr. Rebecca Widener, who is an infectious disease pediatrician at the Prisma Health Richland Children's Hospital. So very grateful to have her along here today. If you have any questions for any of us, this is a live broadcast, so please feel free to use the chat if you have any questions, and we'll answer them along the way, or you can unmute yourself as well, I believe. So, just to get started, these are the most updated DHEC numbers regarding COVID cases. So please note on this slide that this is reported information from DHEC as of Tuesday, April 5th, 2022, and contains the data from March 27th through April 2nd, 2022. So this list contains all of the COVID-19 reported data of new cases, the death totals from the previous week, and the total to date. And DHEC encourages all eligible South Carolinians to get fully vaccinated and receive their booster shots when available. As you can see, this is the percent of residents within each county in South Carolina that are age 5 and above that have completed their vaccination status as of April 2nd, 2022. Looking at this map, you can see that we have the bluer counties that are going up from 50% and above. As the bluer they get, the higher the vaccination status is in that county, a fully completed vaccination status. And then the more yellow and red states are the ones that have the least amount of residents fully vaccinated. So looking at this map, Cherokee, Chesterfield, and Marlborough counties all still lie underneath the 40% fully vaccinated range, which is why it's very important we're all here today to learn a little bit more about how to listen non-judgmentally and be able to talk to these people who may be hesitant or have some other concerns as to why they're not vaccinated. So we're going to talk a little bit about listening non-judgmentally. So people may have a variety of different reasons for being reluctant or unwilling to get the COVID-19 vaccine. You cannot begin to persuade someone unless you know the reasons and the hurdles as to why they are making this decision for themselves. So it's important to set judgment aside, and it's critically important to be a good listener. So without judgment, can you ask this person, why aren't you vaccinated? So making sure that your listening is very intentional and making sure that you are requiring focused effort is very important in order to listen non-judgmentally. So listening non-judgmentally is about trying to understand the other person. So it's about going beyond just hearing the words that are spoken, and involves understanding exactly what the other person is communicating to you. So listening non-judgmentally helps the person to feel heard, understood, and most importantly, acknowledged. So non-judgmental listening builds relationships, it facilitates communication, it facilitates communication, and it serves the purpose of earning the trust of others and helps you understand their situation. Active listening consists of both a desire to comprehend as well as to offer support and empathy to the speaker. Finally, it validates the speaker and makes them want to speak longer about their concerns. By doing this, it will set the tone for future interactions and will even help you with other people you interact with in your day-to-day life. The first thing you need to do when you are approaching someone is to make sure that you are creating a safe environment for the conversation to take place. So this may mean finding a quiet place, or by at least turning away from all of those electronic distractions, your social media, noise, and other interruptions that might take place. This will make the person feel comfortable enough to speak openly without the fear of judgment, and that the speaker will be able to talk honestly in a trusting environment. 3 conditions help to create a safe space. That is acceptance, genuineness, and empathy. So before reaching out to an individual who may be experiencing a mental health challenge to provide non-judgmental listening, it is important to evaluate your own frame of mind. Make sure to ask yourself, are you prepared to express concern without judgment? Are you the best person to help this individual? And can you invest the appropriate amount of time in a conversation right now? Even though the other person's views may be different from your own, it is essential that we respect and accept them. We should understand that others' experiences, regardless of our own, or the reasons why they may be hesitant to a certain decision. Empathy is by far one of the most important characteristics of a good leader. Being able to see things from another's perspective, whether it being in your personal or professional life, it will give you a great insight into their lives, their daily choices, and their tasks. This will allow you to better understand who they are and what they do. So Dr. Widener, have you ever had an experience of where you've had to ask yourself those questions before you can further assess a situation? So those questions being, are you prepared to express concern without judgment? Are you the best person to help assess and help this individual? And can you invest the appropriate amount of time in a conversation right now?
I feel like every day, and I apologize, I feel like I'm asking myself those questions right now as I'm trying to multitask and listen to you guys at the same time. But yeah, every day, and not just with vaccine talks.
Okay. Has there ever been a time where you had to tell yourself that you don't have the appropriate amount of time and you had to assess the situation at a different time?
Absolutely. I do absolutely, because these will come up usually on when you're least expecting them and you don't plan for a good chunk of time laid out. And so in that case, you either take the time and then you are very apologetic to the next person that's been waiting on you. And you tell them that you are willing to spend as much time with them as they need as well. Or you can always politely say that, you know, I realize these concerns are heavy for you and I want to properly be able to spend the time and the concentration with you. And so let's talk over the, you know, if they've come into your office and you don't want them to be inconvenienced to drive back to come talk to you, you can always offer to talk more to them on the phone, or give them your phone number, not your personal cell phone number, but your office number, and say if any other questions come up, or you get home and the spouse or the family member has questions that come up after you talk to them about it, feel free to give me a call. Our door is always open.
Perfect. Thank you for sharing that. I 100% agree with you. Letting the person know that it is a safe space and that you want to take the time to hear out and hear what they have to say, whether it's right then in that moment or making yourself available for them to get in contact with you at additional time is very important to make sure that they feel heard and understood. With that, we're going to talk a little bit about the understanding the reasons why someone may be hesitant to getting vaccinated or whatever the case may be, to different hesitations. So in becoming empathetic and developing a plan to reach the unvaccinated people in our state, it's important to set aside attribution bias, meaning that we need to make sure that we're not making assumptions based on a certain person's reasoning. So generally speaking, reasons for the remaining unvaccinated fall into three main groups, and a fourth, which can consist of a mix of things unique to the person that we may have never even considered. So I'm sure Dr. Widener has seen a lot of these reasonings why, and I'm going to give her a second to talk about what she has seen as well. But first of all, the apathetic group, the first group includes those who view the vaccine to maybe an inconvenience or unnecessary given the circumstances they may in. So for individuals in this group, this can mean that getting vaccinated may just not be a priority in their life, or maybe they don't see the need because they don't see themselves having a high risk complications if they were to get the illness or risk complications. For those who fall into the vaccine hesitant or skeptical group, those can include those who are not generally or completely opposed to the vaccine in general, but maybe you're unsure of the medical science behind it or behind a particular vaccine, or hesitant of its safeties or possible side effects that they might get if they get vaccinated. The third group, those who oppose the vaccine for political obligations, often surround themselves with like-minded people in their communities and social networks where, their beliefs are continuously reinforced. So if you're with someone who continuously are believing the same political obligations as you or having those same reasonings, it can make changing course very difficult because it feels like it could be changing part of your identity. And that fourth group could just be that maybe someone's hesitant due to miscellaneous reasons, some personal reasons. So you may never know what these reasons may be unless you ask and you have that non-judgmental conversation. So this may be confusion about vaccine eligibility. So that was always a huge issue when the vaccine first came out. If there was a cost associated, I know I've heard that question a lot, or insurance coverage, immigration status. Those are all very huge questions that people still to this day are hesitant because they never took the time to learn these things, or no one took the time to ask them why they weren't vaccinated. It could also be some practical considerations, such as not having access to adequate childcare so they can go out and get vaccinated, or maybe transportation needs, or taking time off of work to go and do that. It could also just be very simple, such as the fear of needles and not knowing, how big the needle is going to be when it goes in you, or what's the side effects going to be in that 15 minutes you have to wait afterwards. Possibly having a reaction in that time frame. So just things like that, all of those can be some miscellaneous and personal reasons that are just maybe things you didn't consider. So it's important to listen to these individuals and hear where they are, because there could be a reason that surprises you. So Dr. Widener, as someone who works in infectious diseases, what do you have to say to those who may be vaccine hesitant or skeptical to getting vaccinated due to the medical science behind it?
That's when I just try to sit down and explain the science behind it, and just discuss the studies that have looked at both the safety and the efficacy. I am respectful of people feeling like it had been rushed and so quickly made, and so then I kind of talk about the history behind the mechanism of action behind this vaccine is actually not a new mechanism of action. It's been studied for a very long time. And so trying to give them some of the historical background on it too, as well as the current safety profile data on it. I feel like the orange box and the dark green box, the apathetic ones and the political, ideological reasons, those are going to be your populations that are, you're just going to have to sometimes succumb, that you're not going to get to everybody, and those are going to be your hardest groups. And you can kind of read the room as soon as you, not as soon as you walk in there, but as soon as you mention the word, have you been vaccinated for COVID vaccine? The response you get is, you'll know soon after that, that you're not going to make headway with everybody, and that's okay. That with me, that's okay. With some other doctors, not so much. But with but again, you got to choose your battles, and know that you've done your due diligence about counseling about the safety and the efficacy. And we can't change every mind.
Yes, ma'am. And I do see a question in the chat. Someone, Miss Carpin, said, what do you do about someone, I'm assuming, just spreading plain misinformation?
I think that's when you try to steer the person to good resources and try to dissuade people from reading Facebook. There's some good things on Facebook, but we all know now about the problems inherent in Facebook, about how Facebook and I don't know all of the other social media things, but how they are the algorithms start gearing your own like-minded articles towards your attention span, and so it's always going to just put those things in that misinformation. If you do the clickbait for misinformation, you're going to get more and more misinformation as well. And so trying to change people's mind, not necessarily about the vaccine, but at least about what information they're reading from. So try to dissuade them from Facebook and try to get them more towards peer-reviewed things like the CDC.
Okay, thank you. If anyone has any other questions, please feel free to leave them in the chat. So that being said, after we have that conversation and we listen non-judgmentally and understand what that individual's reasonings and barriers may be, it's important that we meet the person where they want to be at, and not where we want them to be at. We need to meet them where they are. So it's important to tailor our messages. Like Dr. Widener said, we're not going to be able to meet everyone, and we need to make sure that we're tailoring our messages and adjust our approach to the different types of barriers and focus on our relationships with those people who are unvaccinated. So just to reiterate, for those who are vaccine apathetic, some incentives may work to help them and promote them to get vaccinated. So it could be as simple as maybe having some public incentives, like having concert or having tickets to a concert or sporting event giveaways, or providing the ability to travel, free food giveaways, things like that. It even could be some personal incentives. So can I watch your kids for the weekend? Can I mow your lawn, cook you dinner, wash your car? All things like that could be some ways that you can promote and help that person go get vaccinated. So it's just important to figure out that answer to what can I do for you to make this worthwhile? That is what's key. For those who are hesitant or vaccine skeptical, it's important to explain that the technology that enabled us to develop a vaccine so quickly has been in place and been in development for many, many years, like Dr. Widener said. So the safety of the vaccine is in no way compromised. Education distributed to debunk these myths should be distributed as widely as possible. So avoiding those, Facebook articles and focus more on those peer-reviewed reviews from the CDC and places like that. That's what's important, to make sure that those myths are taken care of. And it is important to make people aware of the FDA state of approval for vaccines. For those who fall in the political obligations or objections group, with whom their decision to not get the vaccine is tied to their identity, they may need a per se cover story to safely change their mind and save face. So a good approach is to maybe point them to the people who share their same identity, but have argued in favor of vaccines or have themselves gotten vaccinated instead. So you could always say, here's someone you really respect from the same political, religious, or political persuasion views of you, and they themselves have gotten vaccinated. So it's important to make sure that you're making the narrative of their life fit their identity and finding someone that fits both of those. For those who fall into the other group, the miscellaneous group, try to address some of those practical concerns, such as maybe trying to promote employers to offer some paid time off or give you that break to go get your vaccine, or maybe for those larger employers, those larger corporations, to possibly bring a vaccine clinic on site, offer transportation and childcare coverage, and obviously always having awareness and education campaigns about the importance of getting vaccinated are always important for those who fall into that miscellaneous category. So Dr. Widener, do you have any other suggestions for ways that you can talk to those people, to those individuals who may be facing barriers to getting vaccinated?
No, I think you hit on all of the important parts there.
Okay.
But yeah, you really never know what's affecting people and how people are being affected with the reasons why they're not getting a vaccine. So yeah, thank you for addressing all of them.
Yes, ma'am. And with that, we're going to talk a little bit about trust. So it's important to determine which sources of information people trust. So people have come to know and trust the information that they believe. So to address the hesitancy around getting vaccinated, people need to hear those important stories from their local individuals, personal people that are in their day-to-day life, and then reliable and relatable stories from people who have gotten vaccines, from the people that they trust and they look up to. So it's important about how it not only benefits themselves, but how getting vaccinated will benefit others around them in their community. So while you're having this conversation with these individuals, determine who or what has earned their trust and try to enlist those in your sources of how you're going to promote them to get vaccinated. So strategy should acknowledge the existing distrust of the medical system, pharmaceutical companies, and even the government, particularly among historically marginalized communities. So data on safety and efficacy is easy to come by, but listing out facts and figures alone is likely to be a losing strategy. So sharing an article from a media or news source is unlikely to have effect if that individual distrusts that sort of media that you're showing. So with that being said, there are many pieces to the puzzle, and encouraging the yet unvaccinated to change their mind. So understanding that the unvaccinated are not just a singular group of people, and that the reasons for vaccine hesitancy are not universal is key in developing a plan to reach these individuals. So appreciating these realities and translating them into an action plan can help support our ongoing fight against COVID-19. So successful communities embrace a multifaceted approach, and it takes a variety of different puzzle pieces to complete this picture of success for getting people to get vaccinated. With that being said, community leadership use a set policy and incentives to promote safe behaviors. Fighting misinformation revolving the COVID-19 vaccine is critical, as is appealing to the societal good and interconnecting the principles underpinning public health. So it's important to make sure that we're continuing to have those one-on-one conversations, making sure that we are trying to reach those people that are vaccinated to make sure that they can go out there and promote their stories and their personal beliefs. It's important to have those public awareness and education campaigns about the availability, the efficacy, the safety, and then if there are long-term complications or chronic problems, making sure that people are aware of those and understand what those entail. It's important to encourage employers to adopt vaccination policies that reflect their values. It's important to increase availability to barriers for individuals who are facing those personal miscellaneous reasons, such as transportation or maybe not having adequate childcare or elder care. It's also important to promote businesses and encourage them to participate in incentive programs for those who may be apathetic to the vaccine. And lastly, it's important to bring diverse leaders, from a different groups of people together to talk about why it's important to get vaccine and provide a link to those different individuals groups. So those town halls, the church groups, the school groups, the community organizations, having them discuss and allow the vaccinated individuals to share their stories are very important. In some instances, creating a safe place for the person to feel heard, to make sure their concerns to feel heard, understood, and acknowledged is a very important beginning step. So first and foremost, when you're having these conversations, make sure you're invitational. Let the person know that this is an open space to share their opinions. Listen to them. If they, making sure that they are knowing that you're listening to what they're saying, you're an active listener, you're not just letting it come out of one ear and out of the other. You're listening to them, you're giving them those verbal and nonverbal cues to make sure that you're engaged in the conversation. Those are very important. And with that, make sure you're being friendly and you're open to different viewpoints. You're establishing trust. You're being patient with this individual and knowing that it's going to take some time, and you're setting those modest expectations. So keeping your expectations modest and setting those achievable goals. Like I said, with being patient, it takes time to change mindsets, and having a repetition from a variety of different sources and approaches is key. And last but not least, sharing those personal stories and benefits of being vaccinated. So in many instances, a person must see how it will benefit them personally. So every person who shares a vaccination story and the benefits of being vaccinated will serve as a positive example for the vaccine and a good steward of public health. So do you have any other suggestions for us to understand the importance of how we should create a safe space to have these conversations, Dr. Widener?
No, they're all there. They're all there. I would probably add sitting down with them and not having your hand on the doorknob.
Okay. So just to close, listening to people with a sense of humility and being curious about what their reasonings are and what their concerns are much more likely to put them in position where they themselves are open to gaining new information. So you're in a much better place to talk about how you feel and why you do the things you do. And then you can ask them about their own perspective. So having these different approaches focusing on trusted people, groups, and institutions in the local community, we can begin to move our communities to a place where more people feel safe and comfortable about choosing the vaccine to build thriving communities across our state. And with that, if anyone wants to know more information about how to find your vaccine, you can visit us at our website at scthrive.org/findyourvaccine. On our website, you'll find resources such as transportation needs, information on vaccine sites near your area, and then some more additional information. If you would like any other resources and information, as always, you can always use the following links from various resources such as DHEC and the CDC to find your vaccine. I hope this webinar about finding vaccine and sharing vaccine facts was helpful to you, and that now you have the ability to help find the vaccine for yourself and the ability to help others. So if you have any additional questions for me and Dr. Widener, please leave them in the chat.
There's a good one about how to ask about vaccines in children and talking specifically to parents. I will say it's everything. It's the same. The reasons you gave for vaccine hesitancy is the same for parents for their children as it is for themselves. And so I feel like those conversations are really, that we're having with parents, are really the same that we're having with individuals. And so everything else would apply, talking to them and addressing what their hesitancy is with their children, what the risk factors are for their kids and in their home, what's the risk versus benefits, addressing I know the myocarditis is a big reason for hesitancy with children in the vaccine, and rather parents getting it for their children. And so for that piece specifically, addressing that the cases of myocarditis that we have seen from the vaccine have all been very benign, very short-lived. There's been no long-term heart effects, and they've been extremely rare compared to the amount of heart inflammation we've seen from the actual virus itself, which is part of that MIS-C inflammatory complication we see in kids with COVID. So that's been rampant, and we've seen a lot of that in our own hospital, even in Columbia, versus the extremely rare, very few cases nationwide that have been reported for myocarditis for kids in the vaccine.
And I see someone else, Ms. Hoffman, left in the chat. If someone is vaccine hesitant due to a disability or access barriers, there is another resource for scdisabilityvaccine.org, and she left the phone number as well. So if anyone is that, or knows someone that is vaccine hesitant due to a disability or access barriers, that's another resource that we don't have listed on here. Does anyone else have any other questions for me or Dr. Widener? Okay, well, I would like to give,
can you interchange vaccines? Oh, it's a specific vaccine question. Let me see what the CDC says. I don't think it's recommended to interchange them. But between the Moderna and the Pfizer. But that is one, I feel like the guidelines are oftentimes changing on that. And so that is one thing I would direct to check out the CDC website, because they would have the most up-to-date information about vaccine interchangeable brands.
Yes, I will say that when COVID first started, I was working at vaccine clinics. So I know that if someone had the Moderna first shot and they were going to get a second shot, they had to make sure they got it, either Moderna or Pfizer. Now I believe that you may be able to mix and match while getting a booster shot, but I believe when you're getting your first and second shot, it has to be the same, either Moderna or Pfizer, or if you got the Johnson & Johnson shot. But I think someone else said something in the chat. So Cedric said, many of the clients I've encountered who are not interested in being vaccinated say it's because they don't need it because they have already had COVID before. So do you have any intake for what do you say when you hear that? Because I'm sure you probably hear that a lot.
Yeah, I just say we really, that's great, but we really still don't know. And it's really just like the flu, where there's different strains, and of course we're definitely seeing that with COVID. We still the medical community, the research community, the science community is still trying to figure out what natural immunity looks like, how long it's lasting, how good it is. And so it's still recommended to get the COVID vaccines and boosters, even if you've had, and to complete your series, even if you've had COVID infection. Because we still just don't know scientifically yet what natural immunity looks for, but also, Annie, what you were saying before about bringing back relatable stories. I feel like we all know someone who's had COVID infection more than once, which goes to show you that natural immunity isn't the greatest. I mean, we also know people who've had COVID infection after being vaccinated. But then the relatable part to that is they're just like the flu vaccine. Every vaccine is not going to be 100% guarantee, but the purpose of a vaccine is to help us to help prevent infection. And if we do get infection, to help prevent complications in a more serious form of infection. That is what we're seeing with the COVID vaccine and the flu vaccine too.
Yes, most people's signs and symptoms are a lot less. They are already vaccinated and somehow contract COVID, I've seen.
Yeah. But especially with these different COVID strains between Omicron and Delta and whatever next is coming down, the vaccination would still provide some protection against complication, even if you've had COVID before. And thanks for that CDC link about the mix and match.
Perfect. Any other questions? Well, I would like to give a big thank you to Dr. Widener for taking the time out of her busy schedule.
Thank you for letting me join y'all and for letting me answer my work calls at the same time.
Yes, ma'am. So thank you for taking the time out of your schedule to talk with us today and about the importance of sharing the vaccine facts to South Carolina. So I appreciate it. I know everyone that attended today, they're appreciating it. So we thank you for having us today.
Yeah. Thanks, guys. Stay safe.